you all for coming. It's very heartening to see this many people here. Okay, thank you all for coming. It's really heartening to see this many people here speaking out against the atrocities, frankly, that this corporation has committed on our planet for many years. The marketing of infant formula is really an old story in Nestle's playbook, but they're still playing. We've seen a massive cultural shift in infant feeding practices in the last 100 years, particularly since World War II. We are mammals. Breastfeeding is physiologically normal and essentially free. Sound like something else that we have? Despite this, most children in the world are fed an artificial product that is perceived as a public health necessity instead of a last-ditch emergency intervention. Nestle cut their marketing teeth in the formula industry and successfully revolutionized infant feeding culture. With artificial baby milk, Nestle figured out how to make a killing by creating a captive market for an almost completely unnecessary commodity. With false claims and sales reps dressed as doctors, Nestle convinced mothers and others that their bodies were inadequate to feed their babies. Providing free formula at the beginning of the nursing relationship, educating healthcare professionals, and casting doubt on breastfeeding's adequacy all undermined our breastfeeding culture. Their marketing was so successful that the international community established the International Code for the Marketing of Breast Milk Substitutes in 1981 due to rampant increases in infant mortality. Nestle's marketing machine works despite very poor outcomes. Nestle continues now to insist that they follow the code, but their predatory, aggressive, and deadly marketing practices continue. They also say that everyone else is interpreting the code the wrong way. Mr. Brabeck says that Nestle must be a socially responsible company if the only thing people have to complain about is baby milk. So what is the complaint? The World Health Organization estimates that 1.5 million infants still die every year due to not being breastfed. Nestle controls between 30 to 50% of the infant formula market. This makes Nestle and Mr. Brabeck directly responsible for at least 600,000 infant deaths a year. These are only the deaths directly linked to artificial feeding. This does not account for their longer-term population health impacts. Much of the discussion suggests that formula is not a problem, that dirty water is. Water quality is a major issue, and one that is particularly salient given today's theme. But when it comes to artificial feeding, it is only a part of the equation, and blaming poor water quality deflects culpability away from the peddlers. The WHO code isn't just for places with poor water quality. Even here, the infant mortality rate for artificially fed infants is significantly higher than it is for breastfed infants. Powdered formula is not sterile and is frequently contaminated. The instructions on the can, even if followed correctly, are inadequate and do not include the World Health Organization's safe handling recommendations. Finally, and most importantly, formula is not equivalent to breast milk. It is not almost as good. If you believe that, then Nestle's marketing has been successful. Breast milk is a living food designed by your body to meet the needs of your child in that moment. It changes from day to day and hour to hour. The list of known components of breast milk is 5 times as long as the list of ingredients in formula. Breastfeeding is normal. Artificially fed babies are at increased risk of allergies, obesity, diabetes, many cancers, and even death here in Canada. It is the international code. It is not the international code on the marketing of breast. It is the international code on the marketing of breast milk substitutes, not the international code on clean water for formula use. Formula is an emergency intervention that should be used only when the mother's own milk or another woman's milk is unavailable and there is a clean water supply. The WHO code outlines ways to mitigate the risks of artificial feeding because it is about protecting those most vulnerable infants. The WHO code is more important for formula-fed babies than it is for breastfed babies. I'm going to skip money stuff. It would save us a lot of money if we actually were breastfeeding. Anyway, that being said, but we no longer have a breastfeeding culture. The mother's job struggle due to lack of information and support. Most of our healthcare professionals know little about the normal course of breastfeeding. Their education on infant feeding is provided by Nestle. Nestle has extensive nutrition seminars and hand-selected research databases for healthcare professionals. Free formula samples are shipped to mothers timed to arrive at the most vulnerable times in their breastfeeding relationship. Breastfeeding in public, although legally protected, is highly controversial. Most women have never seen breastfeeding before they've had a baby. When there is a breastfeeding problem, the solution is to supplement not with the mother's own milk or another woman's milk, but with formula. Usually the brand the mother was given in the hospital or by her doctor, often Nestle. This is not the fault of mothers, and those who end up in this situation have the right to be furious with Nestle and the professionals in their lives who did not provide the information and support necessary to be successful. Supplementation is sometimes required due to medical reasons, prematurity, maternal-infant separation, adoption, or other factors. However, the first choice for supplementation after mother's own milk is not formula, it is donor human milk. We used to have human milk banks across Canada. Nestle and a local university physician are directly responsible for their disappearance. A local physician here has been involved in researching additives for formula for many, many years. And it was over 20 years ago, I think. Jodine, you're there now. She knows better than me. But it was 20 years ago. This same physician wrote the document for the Canadian Pediatric Society telling us that we should close all of our human milk banks.
Just a little bit briefly. Thank you very much, Kirsten. Here in Alberta, we have scientists and researchers right here at the University of Alberta who have received funding from infant formula companies. That funding has led to the creation of infant formula products that are sold in 65 countries around the world by companies including Nestle. Those scientists and doctors have been responsible for the creation of policies over 25, almost 30 years that led to the lack of human milk banks, human donor milk banks here in Canada. We have one in Vancouver. They have hundreds in Brazil. Our babies right here at the Stollery right now who are sick, our sickest premature infants who need donor human milk, will not receive it. Babies who do not have human milk are at higher risk of sickness and death. There are 1,000 babies every year in Canada and the United States that die from disease like necrotizing enterocolitis because they do not receive human milk. When the University of Alberta tells you that there is no research money that comes from infant formula companies, you ask if that is really true. I don't believe it is. Thank you.